Welcome back to Tight Flex, here with the brain. So we're going to start off with the hematological terminologies. So we're going to start off with the interpulmonary system, the musculoskeletal systems, the cardiovascular system, the respiratory system, the nervous system, the immune system, the digestive system, the endocrine system, the urinary system, and the reproductive system. Superior, inferior, canal, anterior, vertebral, erosion, posterior, dorsal, medial, lateral. Lateral is usually, it's like a deep, proximal. Proximal is, how you say, proximal. This is proximal to the shoulder, close by. And anatomical positions. When anatomical position descriptions, we assume the patient's in anatomical positions. So it's usually like this. So anteropolar plane. So you have a sagittal, mid-sagittal. So sagittal is up here. Sagittal. Parasagittal. Transverse is midline. And canal is usually right here. Terms of liability. So binary, unary, spinary, contrary. So these abduction, flexion, extension, rotation, circumduction, lateral flexion, reposition, supination, pronation. So dorsiflexion, plantarflexion, elevation, depression, prorection, reaction, inversion, eversion, axial, and so axial, usually axial is the top, the axial is the skull, near the ear. The hyoid bone is literally to the neck, and the rib cage, obviously the rib cage. The vertebrae columns is towards the back, vertebrae columns. And we have the shoulder. We have the pelvic gland, the glens of the pelvic. We have the legs, then the foot. These all contain limbs and shoulders. So binary, so we're gonna go down to the rough head edge. So the spine, the creases, and the tubercle have three groups. The site of the tendonitis or ligament attachment, the fallacy, the phosphate, and the line. Foramen, canal. These are usually the openings from here, foramen, openings, the canals, the grooves. Grooves are usually, here are the grooves. And the type of bones, there are long bones, short bones, and then you have kind of like not 100% flat, but kind of a flattest, and irregular bones and semiosis bones, part of long. So when you're looking at here, take this off, and you're looking at here. So we have here, we have the distal formal, and then you have the growth plate in between. The growth plate is in between. So So there's difference between a sponge bone. Sponge bone is also a contagious trabecular bone. Is found in the long bone and it is surrounded by compact bones. So inside of these have sponge bones inside of, and the surface is the compact bone. All right. Bone development. All bones derive from endomosis and intervertebral or endodosis. Most take years to grow and mature through some eiosis at birth. Consider which bones need to be eiosis prior to birth. So bones develop interporosis and interdorosis. So interdorosis is a cell divided into choroidosis and bones model. So clado is the middle of the model and posterior sublucal of interior of immature bones in the model. Primary erosis center. Most secondary erosis center appears after birth. So growth center are to continue bones in growth. So short bones similar are primary erosis of long bones. Only one short bone has a second erosis center. Vascularization or interioration. All bones must have vascular nerve supply. Nutrient arteries. So arteries that come from the bone all the way here. And the blood supply that surrounds and has a sensory pain for shifts of fractures. So a ligament is connected to a bone. So a ligament is connected to a bone. There are ligaments in the knee, ACL, and bones connect to that. A tendon is connected to the muscle. So a tendon will be connected to the muscle. The type of joint: synostosis joint, fibrous joints, cartilage joints. Semiosis joints, MC type of joints, provide free movement between articular bone. Reforming ligaments may interact. Some obtain articular disc or meningitis. Significant joints. Joints capital cave are enclosed with articular cavities containing a small amount of synovial fluid. All joint structures cover synovial membrane. Synovial joints are plane joints, hinge joints, saddle joints, convoluted joints, ball and scot joints, and pulvent joints. Plane joints. Permeating sliding motions of a superficial or unaxial optional or surface of a flat or near flat movement, limited by a tight capsule and often small. Hinge joints, permanent flexion and extension only. Unaxial joints only move in spinal, reforming by strong ligaments by the joints capillary. Elbow joint. So the elbow joint. So that's what it's talking about. It's trying to tell us a hinge joint. Hinge joint is like this. Hinge joint is a permanent flexion and extension only. This is the extension only, moves in a spinal plane, reinforcing by strength and ligaments by thin joints and capsule of the elbow joint, for example. Saddle joint, allowing flexion and extension and abduction and adduction, circumduction and also possible, allowing movement in vertical and columnar plane. Opposite surfaces are shaped like. Columnar joint, prevention, flexion, adduction and abduction, movement in planes in greater than vertical planes. Circumduction is possible but is more restricted than saddleduction. Bilateral joints, ball and socket joints. allow movement in multiple axes: flexion, extension, abduction, and lateral rotation, and circumduction, multi-axonal joints, surface of one bone moving with a scot to another, permit rotation around the central axis, round process of a bone rotating in a sleeve or ring. Summarize of synovial joints. Synovial joints are pivot joints, hinge joints, and plane joints. Bilateral joints move in two planes. Move in multiple planes is ball socket. Fibrous joints, unit by fibrous tissue, typically movable, extremely limited movement. So you have fibrous joints. Syndesmosis, glopemosis, unit bones with a sheet of fibrous tissue. Cartilaginous joints, a unit by allowing slightly more movement than fibrous joints. Joints, vascular and intervertebral, red blood supply, nervous supply. The Hilton law: nervous supplies a joint, also supplies the muscle that crosses the joint, and skin covering the distal attachment, rich in calcium and ligaments. Introducing spinal musculature, contains red containing portions of muscle belly, white non-contract tension, some attached to organs, skin, and structures of locomotion, providing static support and heat to build as the body. Most named based on the function they serve. Some are named based on the position of length. There are shapes of muscles. Flat muscles. You have flattened muscle, fusiform muscles, quadvert muscles, corbett versus circular, spinal, multi-head, multi-bill muscles. Or original and insertion. Original usually is the proximal end of a muscle, usually the distal end of a muscle. Tonic versus phase contract. A tonic, even while muscles are relaxed, they are always lightly constructed. This refers to a muscle tone. So when your muscles get toned, does not provide movement or active resistance, providing passive joint stability. Joints, muscles changes length in relation to the production of movement. Movement as a result of muscle shortens. The bicep, for example, a bicep curl. That's a movement of muscle. Muscle length remains the same, no movement occurs. In summary, intermatter, equal level, equal resistance, equal gravity, no movement. Dilateral means steady contract, holding the arm in an abduction position, and forcefully, generally by muscles, to expand the force of gravity, that which will go down. This still shorten to rise in abduction, so the muscle relaxes and forces to become less than gravity. Gravity pulling up the limb as the muscle resists and decreases, lengthening to the arm in abduction. So functions of the muscles. Main muscle responsibility is to produce a body movement. A movement containing to produce and desire movement may be one primary movement per action. Flexors, stability, lambs in contractions while movement occurring in distal parts. Syndesmosis and actions of a primary mover opposed to the action of the prime mover. Muscles may be flexor in different movements in different contexts. Why are you responsible for it? When it comes to individual muscles, you will be responsible for introvert and use the chart. So tough, but we're gonna get through it. Boom.